My name is Akua Kwateng-Addo. I'm the Health Office Director here at USAID Senegal. I basically manage the health programs that the U.S. government provides to Senegal, which consists of malaria through the Presidential Malaria Initiative program, family planning and reproductive health programs, maternal and child health, HIV, AIDS, and TB, and health system strengthening. Well, I think probably my personal history is very much related to my interest in global health. As you can tell from my name, I am of Ghanaian origin. I was born and raised in Washington, D.C. to Ghanaian parents, but my parents made sure that I really understood where I came from in terms of spending a lot of time in Ghana. And as part of living a part of my life in Ghana, you come into contact with many public health kinds of issues. One of them in particular is malaria. So in the days that I was growing up, malaria was a disease that was very commonplace and was not really thought of as a big deal. Everybody got malaria. There was really no way that we thought that we could prevent it, etc. And so I've had probably 2 life-changing experiences related to malaria that brought me to global health. And those were namely, when I was pregnant and living in Ghana, I actually had malaria. And it was the worst malaria that I'd had in my life. And so I'm very passionate about malaria in pregnancy and making sure that it's controlled and that pregnant women have access to treatment. Also, when I was in university in the States, my sister, who was living in Ghana at that time, and this was before the days of ACTs, which are the new treatment for malaria. My sister got malaria when she was 30 years old, and she went into renal failure and she passed away. So I have some very personal stories about malaria and public health that brought me into working for USAID and working in public health. Well, I think malaria it's one of the major diseases that is affecting maternal and child health in Africa today. We have made a lot of progress over the last 10 years, but it still continues to be a major problem. In a country like Senegal, it accounts for probably, and this is decreasing over time, but it accounts for a great majority of outpatient visits to hospitals as well as inpatient care. And so it has a great impact on the development of a country like Senegal. And as I said, we've made a lot of progress here. But there's still a lot of work to be done. Well, under the President's Malaria Initiative, we focus on life-saving interventions, targeted mostly at women and children, pregnant women and children under 5. But this is changing. We are moving more into life-saving, providing life-saving services and commodities for the general population. What we spent most of our time on and our resources on is promotion and distribution of insecticide-treated nets to make sure that people are using nets, that they are purchasing nets, that they're actually sleeping under them every night of the year to protect themselves against malaria. We also have an indoor residual spraying program, which is targeted right now in 6 districts where we actually carry out insecticide on the walls of people's houses to protect them against malaria. In addition, we also support the government in purchasing ACTs for treatment of malaria, and we also focus on malaria in pregnancy, trying to get women out when they are pregnant after their 3rd month of pregnancy to take the intermittent preventive treatment to protect themselves and their children, their babies, against malaria. I think the government of Senegal has been very committed to malaria, so it's been very gratifying to work alongside them in bringing these life-saving commodities to the population of Senegal. Last year in 2009, there was a mass distribution campaign of insecticide-treated nets targeting all children under 5 in Senegal. So about 2.3 million nets were distributed throughout this country. And that will have a tremendous impact on malaria and malaria prevention in children. And I think part of the progress that we've seen has been demonstrated by a household survey that we conducted in 2008 and 2009, which demonstrated that we have now achieved in Senegal a 30% decrease in under 5 mortality for children, which is extraordinary and is really moving us quickly towards the goal of the President's Malaria Initiative, which initially was to decrease mortality, all-cause mortality, by 50%. But now that it's we've actually increased our goal to decrease all-cause mortality by 70%. So this is to 2014. So we're well along the way in making progress to reaching our goals, and it's extraordinary. And it's because of the great partnership that we have with the National Malaria Control Program in Senegal, as well as the other partners that are working in Senegal to make this reality. It's difficult to disaggregate, but I think that there are a number of interventions that have been done in Senegal over the last few years. Even though we're seeing a decrease in immunization coverage, previously there have been immunization measles campaigns which contribute to that. We're seeing increases, hopefully, in use of other life-saving commodities. In general, public health is improving, but it's difficult to actually specifically disaggregate it to malaria. But we do feel confident that a large part of that is due to malaria control and treatment. I mean, I think, and with President Obama's Global Health Initiative that was announced last year in 2009, which really focuses on an integrated approach to public health. This is something that we have implemented in Senegal for the last 10 years. We have integrated programs that focus on malaria, maternal and child health, safe delivery, family planning and reproductive health at the various levels, be it at the community level and as well as the service delivery level. So integration is something that we espouse in USAID Senegal and PMI Senegal as part of one of the main approaches that we use. In Senegal, I think that we just need to keep the momentum. We need to increase our ability to get pregnant women out to get their intermittent preventive treatment. Our figures are about 52%, meaning 52% of women are accessing sulfadoxine, pyridoxine for malaria and pregnancy. We need to get those numbers up. It's really about making sure that we're able to reach everybody and reach the population. And we feel confident that we are going to meet our universal coverage goals by the end of 2010. There's great momentum. In fact, the whole team is out doing universal coverage orientations with the National Malaria Control Program. And I think we have a real chance to make sure that all sleeping spaces are covered in Senegal by the end of 2010.